This is a continuation of the series of revision videos for undergraduate medical students. Today we shall look at esophagogastroduodenoscopy or OGDS, its upper GI endoscopy, its indications and procedure. Okay, what is OGDS? OGDS is the viewing of the inside of the esophagus and stomach and duodenum through a camera mounted on a flexible gastroscope. Okay, here there's a patient here, there's a gastroscope with the camera loaded. It is passed into the stomach and the duodenum, and so by you can have a clearer view. And this is the gastroscope, close-up view of the gastroscope. What are the indications for this procedure? Epigastric pain, acute or chronic, all cases of hematemesis and melena, all cases of massive PR bleeding, patients with persistent vomiting where the cause is not obvious, and unexplained anemia and weight loss where the carcinoma of the esophagus and stomach have to be ruled out, patient with an epigastric mass, and dysphagia. What are the preparations that are done for this procedure? Okay, first, a thorough explanation is given to the patient to obtain his consent. Utmost importance is the reassurance to give the patient so that he does not get unduly anxious over the procedure. Keeping the patient kneel orally, solids for 8 hours and liquids for 4 hours before the procedure. And it is very important that the patient's dentures, if it's using dentures, it is carefully removed. The procedure itself consists of done a day case procedure. It is done under sedation, and the most commonly used medication is midazolam, 5 milligrams of domicum, together with local oropharyngeal lignocaine spray. Okay, so the patient is lying left laterally. The surgeon stands in front of him with the scope gently passed through the mouth and the esophagus and stomach. The mouth is well protected by the oral guard here. The procedure itself is quite simple. It takes just a couple of minutes. Patient in left lateral position, airway and oropharyngeal mouthpiece, scope inserted gently through the mouth, passes the pharynx, esophagus, esophagogastric junction, stomach, and duodenum. The areas that the scope traverses are carefully inspected for abnormalities, especially in the mucosa, vessels, and for ulcers and growth. Suspicious areas, biopsy is taken, and it is quite routine to do a flow test for all patients with epigastric pain. And once the procedure is over, there's a scope is retroflected into using the J maneuver to see the fundus from below. Fundus of the stomach have a clear view from below. And once this is done, the scope is withdrawn after thorough suction of the stomach to empty it of the gas. Post-procedure monitoring is quite simple. Patient is monitored till fully conscious. The parameters to consider are BP, pulse, and the oxygen saturation. The patient is fed orally when he is fully conscious, and he is ready for discharge with the appropriate medication, especially proton pump inhibitors or H. pylori regime eradication regime. And the patient is reviewed after a week. Okay, this is another slide to show you the process of gastroscopy, where the mouth is protected by a mouthpiece and the scope is inserted by the surgeon through the mouth and pass gently down into the duodenum. The patient lying sedated in the left lateral position. Okay, this slide shows you the gastroscope. This is the whole set of the gastroscopy set with the video screen here, and this is a close-up view of the gastroscope itself. Okay, what are the complications of this procedure? The complications are rather uncommon. If at all it occurs, it is usually due to bleeding, especially if a therapeutic procedure is done at the same time, such as biopsy or polypectomies. Perforation is another rare complication, which is a very major complication. Perforation is usually may occur if the system, esophagus and stomach, is obstructed and causing distension of the esophagus and stomach. Aspiration usually is due to patient not fasted properly and is heavily sedated. Sedation overdose is a serious complication, especially in the elderly, and dental injury causing oral bleeding. As I said, these complications are not common, and if at all occurs, it occurs in patients with advancing age. I will leave you 2 EMI questions on endoscopy. The first one is on endoscopic diagnosis. Here is a list of diagnoses, and here the list of clinical scenarios to match this diagnosis. Please pause the video to answer these questions, and after that, please resume the video to get the answers. Okay, this is the second question on endoscopic complications. Please pause the video to go through the questions and resume the video to get the answers. Thank you for joining me for this simple short session. Hope to see you again in another session.